The use of probiotics together with chemotherapy in those that are considered more immune compromised and concerns for sepsis. Hi there, my name is Dr. Walter Lamo, naturopathic physician with a practice solely focused in cancer care for over 20 years. I recently saw a patient who has been diagnosed with advanced cancer, is on chemotherapy and some immunotherapy, and was advised not to take any probiotics for fears of potential sepsis or the infection the probiotics going into the bloodstream, causing infection, which is obviously a really concerning situation. But yet, this patient prior to was using probiotics normally and felt it was a value for them. So this all has basically been created or started when there's been some case reports around the world. There's not a lot of them, but there's been case reports suggesting that yes, in some more compromised groups, these probiotics could get into the bloodstream and cause, obviously concerning issues. But also, what's been occurring is the interest in the microbiome in oncology has been getting more and more popular and discussed as well, where now you're seeing research papers, incorporating probiotics that might also assist in decreasing sepsis risks and improving quality of life. In transplant patients, there's now discussions on the more healthier and diverse your microbiome is, your infection risk could be lower. There's now discussions on fecal transplants, so a really messy stool components and helping with graft versus host disease in oncology. So, you can see here that, on the one side, there's some rare concerns which need to be obviously conveyed to patients. But on the flip side, you're seeing this whole other use that's been more in line with what we've observed in clinical practice. I've definitely had patients who've been, I consider, quite immune compromised. And then when they started incorporating a probiotic, all these immune infectious issues started to resolve and they started to stabilize. We've seen patients where they've had some significant gastrointestinal issues and they take a probiotics and that starts to normalize and improve their quality of life while they're going chemotherapy, as examples. And there's many, many others examples. What I'm finding is this information is not being conveyed in a balanced way. It's not so much just like, no, you can't do this. Like, how about all the other data out there? Patients are reading journals. People are reading this information, and part of the problem is that me being a naturopathic doctor and has been around the microbiome before it was popular, trendy since the beginning of my career. We've been exposed to this from a very long time, and have a better understanding on the subject area, and can provide some real world experiences on how rare this could be relative to how useful it could be. So it's not always as simple as yes and no. And so while on the one hand, I understand the importance in conveying these risk concerns, on the flip side, there could be definitely groups of patients that could be missing out on some really good, wonderful outcomes. So anyways, just wanted to better explain the subject area to patients or to people out there that are just a bit wanting some more understanding.